Can't wait for this conversation.
We're good, dog.
And introducing officially my sister, Evetta Shoulders. I know for years I've been tearing that other name up. So can you say it right for your sister? Ooh,
LaPread-Shoulders.
I know.
Mm-hmm.
Okay, y'all heard that right.
Mm-hmm.
She gave us five
That's
words.
a French twist there.
I know she all y'all know how I am. I would
Something like
take something like that. We always ask for five words to describe you. And the words, I didn't look at the words until right now. And I'm gonna see, since you are my sister, if it really describes you. She says she's caring, inspiring, responsible, determined, skillful, and trustworthy. Hands down. No question. But I'm gonna ask you, did you just why did you choose these words?
Well, um, I had to think in reflecting who I am. And people evolve into you should evolve over a period of time to better and better and better. But my profession encompasses all of that, but it marries up with who I really am,
Mhm.
and I try to practice all of those every day.
So, if there is one of these words here that you listed, which one really, really embody who you are as a person?
A caring person,
I would agree.
very
I,
caring person.
I really would agree. And then I
Because
have
that caring covers all of that.
it covers
Inspiring, responsible, determined, skillful, trustworthy. All of that is who you are.
Yeah,
that
that's who I
is who
am.
she is. And then we have Dr. Hunter Hammill. Hammond?
Hammill.
Hammill. Okay. I am so honored to have you here. And because of Miss Evetta, I am now meeting you. Thank you. I'm just so honored to have you here. I've heard great things about you through Evetta. And so you chose the words ability to set up someone I've never met. Why did you choose that?
It's
Because
not set up. It's upset.
I'm sorry, upset. I'm sorry, upset someone that I've never met. Why would you say that?
because sometimes just rumors, for example, taking care of a certain group of patients.
Mhm.
When I first started taking care of AIDS patients, and where I was in the army, and this guy came up to me and said, "But you must be gay because you have to take care of AIDS patients."
Mm,
But I know you're not.
mm.
So people live on rumors and misconceptions.
So they assume something.
Sometimes I would present the data on some subject, medical area, to the chairman who was in charge. If they just had the facts, they'd side with me. They'd understand. What would happen is they take the same facts and come to the opposite conclusion.
Oh wow. Oh wow. So what happens when you give them a set of facts and the fact says this and they come to a different conclusion?
I mean,
What do you do?
well, I still do what I'm going to do, but
That's
got
where
me in
you
a lot
upset
of
them at,
trouble.
huh? I get you in trouble.
Yeah. So you Dr. Fauci before Dr. Fauci came out.
I love it. I love it. Well, guys, as you can see, we're getting ready to get down and have a conversation. Evetta, uh, tell me why this topic was also an interest to you. What's going on in your world?
In terms of the topic that we've chosen, would
Yes.
you like me to say what it
Yes.
is?
Go ahead.
Transgender care.
Hmm.
Um, for a lot of reasons, and it in part has something to do with Dr. Hammill too, because he was one of our lead physicians, and I was the nurse, a research nurse coordinator for Baylor for many years, and we worked with marginalized people and people who no one wanted to see, which was our HIV patients.
Mhm.
And I had the pleasure of working in the clinic with him, and just learned that although I came to Houston to work with people who had less than others, that was just in my heart. And working with him showed me so many different kinds of people and how people treat them. And it has a lot to do with Dr. Hamill and remembering how he we worked with people less that had less that were poor and marginalized.
Mhm.
And so in that, um, being in school, I'm a doctor nurse practice student at UT Tyler, and we had to choose a subject, and so I kind of went back to what was innate, what I learned with Dr. Hammill, and I chose the transgender population. So, and then my experience with watching how they were treated when I was in doctors' offices. People stared at them and talked about them. It was just broke my heart. So, our most recent experience was being in a doctor's office and watching a patient go to a desk and checking in. And as he sat down, and I just watched the room and watched the reaction of people, even the people at the desk started whispering about this patient. And I said, oh, this is going to be my topic. I've got to, as a nurse, do something to change that attitude toward patients.
Well, I'm just so grateful that we have this connection that we have, that we were able to have this conversation, because I am one that believes that everything starts with conversation. I have no knowledge of transgender other than what I see. And so I have to be the first one to say I'm just as ignorant. And I don't mean ignorant to that magnitude, but understanding of it. I don't treat anybody any different than I want to be treated. So it has nothing to do with me being ignorant to a human being, but I'm ignorant to the care. I've been in healthcare for 30 something years, and I have no control over how a physician treats them, but I have a lot of control over how the staff will treat any patient. So with that being said, I am so ready to have this conversation.
Amen.
Brother Carter, you have anything to say?
Well, Miss Evetta, you did mention HIV in your opening here. And my question would be, because you used to hear about HIV back in the 80s. It was very spoken of back then. And I rarely hear anything about HIV today. So my question would be, has the uprise in HIV, is it more happening today than back in the 80s, or has it
Subsided?
yes?
Well, from a nursing perspective, I think probably the best person to answer that question is Dr. Hammill, because that is actually his specialty.
Yes, I would agree with
infectious diseases.
Okay.
That's his
Wow.
specialty.
There's one thing, since we're on the radio, called the PrEP program, where people take an HIV drug to prevent them from getting HIV. But what they fail to leave out in the message is that study was originally done with condoms. If the condom broke, that meant, you were covered. Unfortunately, people have taken that study, and the advertisement only mentions safe sex, doesn't mention the word condom. And since the condom's been dropped, what's happened is, I feel we have a huge rise in syphilis in this country. Sometimes Houston leads the nation in congenital syphilis.
Houston does.
Houston, Texas.
Wow.
So we see a lot more syphilis, which means people, they get the message, don't use condoms, other things spread. And then there's resistant HIV. So I actually see new HIV patients every week. It's not going away.
So do you think that we know now that it's not going away, but do you think that conversations just have shifted because of for political reasons or COVID or whatever? It's just the conversation is just not really happening.
Well, the conversation that I think needs to be done has nothing to do with sex per se, has to do with education of self-esteem. Self-esteem in middle school and high school students is what needs to be done. It has nothing to do with talking about condoms on broom handles. It has to do with having self-esteem. And that's the point people don't talk about.
So when you say having self-esteem, what I hear is individuals respecting themselves and believe. Okay. And I think that conversation starts in the home. I think it also should be in the school, but it definitely starts in the home with a parent teaching your child to respect themselves. And unfortunately, what's happening now with some of the younger generation, some of the younger moms having kids, the kids are seeing what their parents are doing, and some of them, and they're just kind of following suit. There is no respect there in the home.
It's a complicated issue.
It's a very
Very.
complicated.
And so that's why we have you on the show today, Doctor.
Yes.
To help
And we-
enlighten us on
yes,
this
we're-
conversation here.
Okay. I still want to, since you started on the AIDS
Mhm.
side before we go into the transgender, where is the largest population of AIDS patients coming from? Since we're saying here in Houston, what age group is that in?
Well, we certainly see most of my patients are in their early 20s when I first see them. Though I will say I've delivered patients 10, 20, and 30 years ago that I'm still following. So HIV is not a death sentence if they take their medicine. So I have an aging population, but still have a continuous influx of new patients.
Mm.
And it follows the demographics. Initially, they thought it was a gay disease. They called it the gay plague.
Mhm.
But now we know it's an equal opportunity employer, male to female.
So why do you think that people like to put a stigma on it being a gay? They have to be gay if they have AIDS.
Well, early on, that's how the endemic started. Actually, when I was an infectious disease fellow, I said, gee, this disease only affects gay men. I don't have to know about it. So I was an obstetrician. Unfortunately, I was totally wrong.
Mm.
And in Houston, it's an international city. We have patients from all over the world coming. Most of the patients I see that are HIV positive are homegrown Houston natives. They're not from another country.
Wow. But
Mostly from prison or something like that.
Prison's another area. Actually, when I first came to Houston, I started at first pregnant woman I saw was HIV positive, had the same home address, Harris County Jail.
Mm-hmm.
Then I started a clinic at the county jail because in those days, we're going back 30 years. That was the start of things.
Mm-hmm.
Fortunately, that later we reported some of our cases, and it politically looked bad for us to have all this at the county jail. So then they closed the clinic.
Wow. Because it was all about politics.
Politics and money.
Whew.
So what percentage do you believe that people just didn't care about the individuals that were coming up with HIV?
Well, initially, if you're HIV positive, you were isolated.
Mm-hmm.
In the old days, remember in New York City, they wouldn't just put everyone on the barge and sink it.
Mm-hmm.
There's a lot more local discrimination. Now that's improved.
Mm.
It's become a chronic disease, but still has a big stigma.
Mm-hmm.
Okay.
And then you can categorize if you're gay, if you're a transgender, you're a minority person.
Mhm.
It gets even worse.
Mm-hmm.
So let me ask you a question. I'm glad you said minority. Because there is another, I believe, a misconception that it's only happening in the minority community.
That's definitely wrong.
Yes, so let's talk about that.
As a matter of fact, I had one patient, doctor called me, had stuck himself with a needle during the surgery and then tested the patient to HIV positive. He said, she can't be HIV positive. She's got private insurance.
Isn't that ignorant? Yeah, yeah, she can't be.
Yeah, so that's the kind of mindset. There are no boundaries. I have people from the Beverly Hills neighborhoods and from other poorer neighborhoods.
So it's all in a lifestyle.
Yes, but I will say the patients who are poor and on the street, being HIV positive is just another headache. Patient who's the Beverly Hills type has had everything perfect in the world, and now they're positive. They get more depressed.
They
tend to be more depressed and try to kill themselves sometimes.
Then the person that this is a part of, it kind of like
Another problem
with someone that has been, I've lived with not being able, penny pitching. So it's hard for me to come up with food I can survive versus someone that has had a silver spoon in their mouth.
Right.
Oh, wow.
Yeah,
Wow.
I've had one woman come and slit her wrist in my waiting room.
Wait, I'm sorry. Can you please?
I had one woman come in and she slit her wrist in the waiting room.
Because you had to give her a diagnosis?
But her diagnosis was verified.
Mm-hmm.
My God.
But she lived.
She lived. And how is she living?
Now she's, accepted her diagnosis. And as I tell the patients, I first tell them the diagnosis. Said, right now I'll go through the pluses and the minuses and the meds and all those things. And I'll say, you may not hear me. You're in the shell shock period. And
Mhm.
in about a week or two, you may say, what do you say? Just call me.
Mhm.
So that often occurs. And gradually, and I say, and if they're delivering a baby, I said, you will live to see that your daughter or son graduate from high school if you take your medicine. You don't have to like me. You don't have to love me. You just have to listen to me. That's the speech.
Wow.
Mhm. The ability to upset someone I've never met.
I heard what he said. I heard what, wow. This one here, I'm gonna just throw a question out there.
Mhm.
And now we're getting ready to walk into this transgender conversation. Can you explain transgender to someone who might not know what exactly it is?
My definition isn't the definition with the gender intro, politically, all the medical terms. My gender is someone who was born and they feel they were born in the wrong gender.
You say they feel that they were, but they're
So,
not
for
necessarily
example,
they
a
were
man
born.
thought he was a woman thought he was a man.
So, can you tell me, since you've been practicing and taking care of these patients for a long time, can you break that down a little bit more when they say that they feel that? I mean,
They were
explain that
born
to
in
me.
the wrong body.
Yeah, can you explain that to me a little more? I
And
understand.
it's usually not someone who just decides to wake up and say, gee, I'm a trans person. These people have had this feeling since they were in high school,
Mm.
Mhm.
usually.
So, does that come from an environment? Again, I need you to educate me. There is no. I hope I'm not in any way offending anyone. I'm only asking questions because I want to get a better understanding.
Mhm.
So when I hear you say that they feel a certain way, so that feeling just happened at high school, or could that feeling have been there long before, but
I
they
think
just got a voice to say something?
it's been there since they were born, only the expression of it doesn't manifest itself until they get a little older, till gender identity occurs as teenagers sometimes. But born in the wrong body is, I guess I would say it. And you'd be a male to female, female to male. And they're very distinctly different.
Okay. Wow. Evetta, you have anything to say on that? What has been your experience since now you are traveling this road? How did you feel when you first started to understand and see
Well,
more?
there's a whole lot to learn about the transgender population, a whole lot, especially nursing wise, and as I said, Dr. Hamill's teaching me a whole lot. You know, how you approach the subject, but to me, the main thing is not being judgmental. If somebody feels that way, respect that, because that's not my job to be judgmental. It's
Mhm.
my job to care for that person.
Mhm.
But I need to be educated more about how do I talk to them, what do I say, how do I introduce, how do I speak with them in terms of nouns and pronouns, and use certain nouns and pronouns. I'm learning a lot of that from Dr. Hammill. But the
Give me
main
an
thing,
example of a noun and a pronoun
or
when speaking to
her and she,
Mhm.
and
Well, they use the word dead name. If you were John and now you're Josephine.
Josephine.
If I call you John, you're calling me by the dead name.
Yeah,
Oh,
they call it a dead name.
a dead name. That means now I am.
Mhm.
Oh, wow.
And
That's complicated.
it is
Yes.
complicated, but in
Mhm.
his practice, his staff knows the new, oh, I call it the new name, but it's the get rid of the dead name. And what's my new name? If I was Bob, now I'm Brittany. And you need to remember to address a person that
By
way,
Brittany.
by Brittany.
Mhm.
And and they're offended if you continue using the dead name.
Mhm.
So,
And I don't blame them for that.
So that make me think of Kunta Kinte
No.
when the movie Roots,
Mm-hmm.
and
Not
they want to
everybody's old
call
enough to
him
have seen that
Toby.
movie.
Excuse me.
Not everybody's old enough to have seen that.
Yeah, but it reminded me of back in when they were slaves, and they were had a name, but when they got to the plantation, the plantation owner gave them another name, and so it's pretty much sound the same. Uh,
There is a different, once they go through this process, as they're going through this process, they are shedding off the old them that they were hiding. And now this is who I am. And I've accepted, and I'm asking you guys to accept it and respect me.
Respect that. And why not?
Why not?
It's kind of on the vice versa.
And you don't know you can be gender neutral. There's a big difference between, I used to have a clinic called the Special Mothers Clinic at Ben Taub. If you had TB, syphilis, gonorrhea, AIDS, or using drugs, you went to the Special Mothers Clinic rather than drug abusing AIDS clinic. And I had to teach the staff when they come up to it, they're going to say, what do you want? Say, how can I help you? There's a whole different spin on things.
Yeah, it's just how just in the words is respect. So how can I help you versus what you want? What you want? What do you mean what I want? I'm coming to a clinic. I need help. I don't know what I need. I just want help. Wow. Ooh, do you feel like this was a calling that was on your life long before you got into it?
I tend to be in the wrong place at the wrong time.
Wow. Guys, y'all, I told you this conversation was going to get very candid. I'm going to put another question out there on the table for you, Doc. And it is, what is the difference between gender identity, gender expressions, and sexual orientation?
Gender identity, gender expression, sexual. Well, sexual orientation is whether you're gay or straight. That has to do with having sex. Gender identity is what you identify yourself as. For a trans patient, the gender identity would be the gender they feel they were born to. And then what was the other one?
Identity.
Expression.
Gender expression is whether you dress as a man or a woman, how you dress.
Okay. So
you and I are dressed differently.
We are. And we are different.
I have no makeup on.
You have none. And I have some on. Okay.
So, Doc, let me ask you something here. Once a person identify themselves as transgender, is there a case where the person returned back to their original selves?
Well, there's something called a transgenderist who wants to be transgender but isn't. People the transgender patients don't go back. When you ask them how long have they thought they were like this, they'll say years. It's not an overnight thing. So you have to be very careful that you don't get someone who just is trying to be trendy in a moment in an odd way.
Okay, so when that was a very good question, because you have some people that just kind of go with the fad. So when you see a female dressing as a male, that doesn't necessarily mean that they're transgender.
Yeah. Transvestites, people who dress in the clothes of the opposite gender, they're not transgenders. They're transvestites.
Okay.
Oh, look, now you done confused the heck out of me now.
Break it down. You done took me down another. Explain that.
So if you were like a queen dressed as a woman in a drag show, and you're gay, that you're not transgender.
You're just gay.
Yes.
Okay. So
even if you're a heterosexual male, but you want to dress up in women's clothes, you're not transgender.
Oh, this is deep.
So you're a transvestite.
Yes.
Exactly.
So for me, what I'm hearing you say, just because you put on a piece of clothes, that does not define you as being transgender.
Correct.
There is a whole. Do they go through the medical change, or not necessarily?
Or they have the sexual reassignment surgery, as they
That's
call
that
it.
word. See, that's what I was looking for.
That if it was a man becoming a woman, a transgender male to female, no, correct, a transgender female to male, they may get their uterus and their breasts removed and their ovaries. The female to male transgenders tend to be more solo. They're not in a group. They're not as organized. Now the male to female transgenders, just the opposite. They may have their testicles and they're removed and their penis, and have what's called a neovagina. They may get breast implants.
Oh, okay. So
now, not all transgender patients A, can afford it, or B, want to go that extra step.
Okay. So when a female, most females that are taking hormones, and I'm
Yeah.
yes, and their bodies start to change, because I guess the question I'm asking is, I've seen some women that were women, and then all of a sudden you start to see how they are physically changing.
Mhm.
They start to grow facial hairs. Their bodies start to bulk up. But is that just from medication, or is that what
We're
is that
talking
from?
about trans patients.
Okay, you got to help. I'm sorry, I'm going back and forth,
Yeah.
but
If,
I'm really
someone is a transgender female to male patient, as we say, they're on the T, the testosterone.
Mhm.
They'll grow a beard,
Mhm,
they'll develop muscle mass,
mhm,
female fat distribution changes, they'll lose their hips, which is what they want to do.
mhm. Do you find that those patients are, because they're on the hormones, do they become more? Do they come sick from the medication, or do they? I mean, I guess I'm just trying
Well,
to
they don't
understand.
become aggressive. That was a thing people used to think, become very aggressive and hostile. That has not been my experience.
Okay.
They do feel happier. I ask all the patients, you feel happier, and they feel wonderful now that they're in the right gender. And they still have female genitalia. The clitoris will hypertrophy to be the size of my thumb.
Mm-hmm.
But other than that, it's harder for the genital changes to make a neopenis and testicles, although there's an operation to do that.
Okay.
Mhm.
Wow. Okay.
So it's easier for a male
Male.
to transform to a female versus a female transforming to a male.
Yes, in one regard, the male, the female to male, when they on the T, they grow a beard just like yourself,
Hmm.
and they can pass. There's a term, they're unclockable.
Mm,
Hmm.
Unclockable means you pass,
mm. You pass.
as no one notices you're trans.
Okay.
Clockable means I know you're trans.
You know it.
The hardest thing that for the female, the male to females, is to get rid of their Adam's apple. They even do an operation to shave it down.
Oh wow. Wow.
Wow. That's got to be physically, mentally exhausting.
And financially,
Yes.
And financial is very expensive.
Wow.
Okay.
Oh, boy.
I'm about to go there. Okay.
You know, what I'm finding, I just want to
Go
add,
ahead.
it's just a lot of patients, and Dr. Hammill will tell you too, are going to Mexico to have this done, the sex affirming surgery done, because it's so expensive here.
Hmm.
The scary part in being a nurse is that, and doctors as well, you've had your surgery in Mexico and you're coming here, and then who's going to want to take care of you now?
Right.
Mm.
And I don't know if
Cleaning
If
up,
there's a
cleaning up somebody else's mess, huh?
a lot of them go to Thailand too.
Oh, and then they come back just all butchered up.
Well, if they have a complication, there's a dilemma.
Yeah.
Well, what is the dilemma? You can't.
Well, the surgeon, if you're a surgeon here, you really don't want to take care of another surgeon's complications.
Because now you're tied into the liability. Of
Well, and they're usually complicated.
Okay. Wow. Does the family play a significant role in the patient's transition?
All right.
I'm asking.
Yes,
I'd say yes.
Okay.
And it's very interesting. Some of the families are accepting, and others they throw them out of the house.
Mm.
And there's sometimes violence, often from the male parent, the father.
Okay. Now I'm glad you're going there, because I want to try to understand. Is it because do you find it more with their sons, or do you find it more with their daughters that the male parent becomes so enraged or unacceptable?
My experience is with the daughters becoming. It's with the sons becoming a female, male to female.
Mm-hmm.
But I think it hurts with both.
You think it hurts with both? Do you think that they take it in because they feel like they maybe have failed their child? They make it
Yeah,
about
my son's
them?
a man, but now she's a woman.
Yes. So do you think it's because they feel like they failed their child that they take it so personal, or do you find that they're more concerned of what the community is going to think of
It
their
could
child?
be both. I'm not a psychiatrist, but I would say there's a gut reaction, and many of my patients have been disowned by their families.
Okay. On that note, we are going to go to commercial, and we'll be right. I think we're going to do a commercial and a song. Brother Carlin. Oh, look at him. He done got on the board over there. I tell you, this conversation, I am being educated. I am enjoying it. And yes, Doc, you want to say
Can I
something?
just say one thing at
You
the
sure
beginning?
can.
For historical purposes, Hitler, the first group he rounded up and executed were the transgender patients.
Wow.
And every year there's a day of remembrance at the Holocaust Museum in Houston for transgenders that have been murdered.
Okay, we're gonna
Transgender been around a long time.
Can we go back? I really want to. I don't want that to get missed at what he just said. That was definitely some education for our listeners. And if you could, I want you to speak right into the mic and repeat what you just said.
The first group Hitler rounded up and executed were the transgender patients. And every year at the Holocaust Museum in Houston, there's a day of remembrance for the transgender patients that have been murdered.
Wow. So actually, with that being said, why was that the first group of people that Hitler, what do you
I don't
think?
know, but they stood out in the crowd.
They stood out, and he knew it. And,
Yeah, it's called being different that stands out.
Wow.
That's a good point.
That's a very good way of putting that. Wow.
And just for one other comment,
Go
my
ahead.
mother, when she found out I had all these patients, she said there's a spark of the divine in everyone.
Spark of divine in everyone.
It really is because wow. I'm
So,
sitting here. Go ahead. No, you can go.
I'm jumping right back into the conversation here. As far as let's talk about suicide here for a second. The rate of suicide, is it greater between the gay, transgender, or
Patients of AIDS, whatever.
no, what's the other
Transvestite.
Transvestite. Yes, that's the one.
I would probably say transgenders, but I may be wrong. But there is a high rate of suicide among transgenders.
And that is caused by
Rejection.
mostly rejection from other people, or rejecting themselves for being the way
No,
they
not
are.
themselves, baby.
That's a question, honey.
Yeah, I know.
It's from usually the family
Mhm.
rejection. And think of it, it's not that you had to go into a separate bathroom, you couldn't go to any bathroom.
Yeah.
You couldn't go to any.
Wow.
And I just want to add that just in some of the research that I've learned on this journey, that it seems like gay people are more accepted. They are more accepted than your transgender people. I mean, I guess people have kind of gotten used to the gay population, but the transgender, they're just not accepted. They're just not
It
accepted.
seems so strange.
Yeah.
When especially when a trans person is 6, the big tall ones, and portray themselves as a female. I mean, it's kind of for the average individual, it's hard for that individual to accept them. And then some of them, I worked in the TDC for a number of years back in the 80s. And I used to see inmates show me pictures of them on the outside. They will fool you to believing that they are really a female until you really go home with them. So I'm thinking there's a lot of murder that take place with those, and assault and murder with people like that when they find out, once they get to the room to have sex with these individuals, that they're not what they say they were.
And why are they not if this is something that they've been affluent or been, they knew they were different, they knew something was going on with them until they were able to talk about it in probably high school. Why would an individual portray themselves to be something different?
Well, from my point of view, if you've been rejected all the time, you very slowly reveal things.
Okay.
And when they become intimate, then of course they haven't had their sexual reassignment surgery,
Mhm.
and because that's a moment of violence.
Yeah.
Wow. Do you have a lot of patients that have either been have been in that situation or have been assaulted for that?
Yes,
And how do you communicate with them about putting themselves in that situation?
I just try to. Some of them, particularly the male to female transgenders, become very promiscuous because they want to be accepted as a woman.
Mm.
So trying to have sex is something they want. So as far as violence goes, many of them tell me stories about when they've gone out and been beaten up.
Mm. And what are your words back to them?
Try to stay safe.
Okay. Try to stay safe.
Yeah, so is there ever a moment where you say, you are not a female,
No,
you are a male, or you
no,
are not a male?
that'd be the redneck approach.
Okay.
Not to offend you.
No. Because I'm sure that there are a lot of parents, there are a lot of
Yeah.
people out there that are listening right now.
They
They
will-
know out of the tens and tens of people that are listening to the show right now, I ain't say tens of
But
millions,
they-
but
but they don't. Their parents may tell them that, or their fathers, or
Right.
other people. School, they may tell you that. Look at Bruce Jenner, he was a decathlon champion,
mm-hmm. Yeah.
the ultimate male.
Mm-hmm.
Mhm. Yeah.
Yeah.
So, whew, well, my team have put some questions together that they want us to ask you guys, and their questions are always very good. And I love for my the younger generation because they are definitely a group of individuals that are not afraid to ask the why.
Okay.
And so we have some questions that they want to have. Diana, on the board, Diana, you want to go ahead and ask your
Yes.
question?
My question was, why do you think people are homophobic or transphobic?
Well, in my field, it's just your own personal. Well, the norm is what we've been taught. Well, and a female is. We've been taught that. We've been brought up to think that this is what it is, and because that the difference, because there's a big difference there, it's something that we've not been taught to accept.
Mhm.
It's acceptance, you know. And then I think sometimes people are just afraid of what's not what's new or
Mhm.
Oh,
different.
what's different?
What's different,
That's
you know,
different than what
than
they
they're used to,
Mhm.
you know.
and
yeah.
so they don't want to go any further to get an understanding.
No,
Okay.
no. This is what, and then you've got to remember those people. I'm a Christian, but those who feel that the Bible says this,
That's
and
where I
so
wanted to go.
so judgmental about what the Bible says.
Mhm.
Well, yeah, okay, the Bible says this is an interpretation, but it also says treat everybody like you want to be treated, and
With love.
like with love and care and
Mhm.
kindness, and treat them as a human being.
So how can you treat this person any different when you're going to sit up? Because you know what I do. Well, you only know what I do based off of what I show you.
Mm-hmm.
They're showing you who they are,
Mm-hmm.
and we're going to treat them different, but they're still a human being.
Yeah, still human.
Yeah.
Mhm.
All righty then. Well, I have Stephen, a question that Stephen, another one of the team members wanted me to ask. Tell us about your history with the LGBTQIA plus community.
Wow, that's a whole lot of initials.
Yeah, I'm glad we wrote it out there.
Lesbian, gay, bisexual, transgender. I don't know what that last.
Queer.
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 Mhm.
Queer
Tell me
experience.
what my.
QIA. Tell us tell us about your history with that community.
Well, yes, my history goes back to one of my sisters is a lesbian.
Mm-hmm.
I remember when she was living in another city, and my mother thought she was going to marry her business partner, a man who was gay. But I thought to myself, my mother is so out of touch with reality.
Mhm.
But then they were accepting.
Mhm.
So I think my experience has been when you work with people and you don't draw. If I work with you, the job may have nothing to do with you, how you perform.
Mhm.
gay, straight, trans, whatever.
Mhm.
I think people just, when they work with people shoulder to shoulder, they get a different perspective.
Mm.
But I've seen many comments where people will make snide comments behind people's backs.
And
Mhm.
do you think that that comes from a lack of ignorance, or do it come from is that politically? A lot of those comments are politically
Get
driven.
back to how they were raised.
Mhm.
I'll tell you a story if I can.
Yes, you can.
My son, when I was in Cleveland, Ohio, this other doctor had moved in, had a son the same age. So he said, could he go play with him? And then my son, who was 5, came back that day and he said, Dad, am I Mexican? I said, no. He said, am I black? I said, no. He said, why do you ask? Because Johnny said if I was black or Mexican, I couldn't play with him.
Mm.
So my son was so colorblind, he didn't know the difference.
He didn't know the difference.
See the difference between that. Can you imagine how that other kid's going to be raised?
Yes,
He'll be the kid who's prejudiced.
yes, because
So I get back to the parental.
it goes back to what they've been taught.
Mhm.
Wow, that's
So, Dr. H.H., have you always been accepting the culture of the I'm not going to even try to do the
okay.
initials.
LGB, you got to get them
Have
right.
you always been accepted to this, or this was something you learned to accept over a period of
Well, in
time?
high school, nobody was gay.
Mm.
That was the attitude.
That was the attitude it was
Mhm.
getting.
On the other hand, I was raised in the North where there may have been segregation of the gay community, but there was more acceptance
Mm-hmm.
Mm. So, in the North.
in the North.
Yeah, the North was more accepting to
Mhm.
blacks early on. Also, it's just
Yeah. So they were just more accepting to different.
And I think it just depends on how, again, getting back to your parents.
Yes.
Mhm.
How you were raised.
Yes.
Well, why do you think that it is so unaccepting in the Southern?
I wouldn't say that's the case today. I will say one group wants some other group lower than them so they can stand out.
Mm.
Mm.
They always want to keep somebody lower than them.
There's no other way to put that.
Break that down, Miss Evette. What Doctor just said there.
I got it in my head.
Go ahead and talk about it.
Let's talk about it.
Well,
One group want to keep another group down.
yeah. That's how I see it too.
Mhm.
And then the other piece I've learned in being a nurse is that people tend to whatever is the popularity is the popular thought process is let's go over here so we won't be a standout, even though that's not correct. They
Mhm.
still do it. But like I said, Dr. Hammill may remember this when we were at in one of these in the medical center a long time ago, and we moved to Methodist because of this. He had a lot of HIV patients, and a comment was made they didn't want those kind of people in that building.
Mm.
And I don't know if you remember that. And went over to Methodist and opened up Methodist OBGYN.
I do remember being at a dinner and some faculty member's wife said to me when she sat down next to me, when were you tested last?
Oh, wow.
Mhm.
Oh, wow.
But that's minor compared to what happens to the patients.
Yeah, and I was getting ready to say, so if you, as a physician, is experiencing that based off of you just trying to care for this patient population, imagine what the
Yes.
patient is going through. It's nothing.
It is.
There is no comparison.
Now, one thing I have found, since I'm in the race to praise, the churches are accepting, especially when people die.
Mhm.
Say that again.
Churches are accepting, especially when people die.
Mhm.
I remember in the early days, I used to go to all my patients' funerals.
Mhm.
They would die more, but the churches are accepting.
Mhm.
Churches are accepting.
Mhm. Yeah,
Mhm.
they're more accepting and supportive.
But are they more accepting once they die? Or are they more
Well,
accepting while they're living that life out? What happens to them in the
When they're alive,
when they're alive?
Mm.
it's hard to know.
Well, the church, often they're afraid of churches, but that's not because the pastors are unforgiving.
Mhm.
and I found the churches to be helpful.
Okay, that's good to know.
Some churches,
Some churches.
yes.
Let's talk about that.
Yeah,
You should know we
all
had that
churches are
Yes,
conversation.
not.
let's talk
Yeah.
about that. And I really do want to go there. Yes, we're on Raise to Praise 100, which is a Christian radio station.
Mhm.
However, we are talking about human beings.
Mhm.
And I want to talk about why is it that sometimes we tend to take our Bibles and use our Bibles as a weapon to beat something over someone's head to prove a point.
Mhm.
Almost as if you never even open up those words where it talks all about love through it. Why is it that happens, and what's your opinion on that?
I just think what we were talking about being with the group,
Mhm.
you know, it's like we're in Texas and transgender is not accepted. Gay wasn't accepted. When I worked with Dr. Hammill in the 80s. It wasn't accepted. So whatever is the norm, and that's what people go with instead of thinking for yourself and saying, you carrying that Bible, but you're going to be made accountable for how you treat people.
Mhm.
And to go back to what I was saying about acceptance, it seems that we don't have a problem. We in medical, we treat the person who's hurt, who may have killed 10 people,
Mhm.
or done something terrible to a child, or the person who is on the street, a prostitute. We
Mhm.
still take care of them. So why is our transgender population different, or our gay population different? Why do you treat them different? It's not for us to judge. And if you read the Bible, if you really practice it,
Mhm.
it does say that. But then you see some pastors who can go to, well, this is sinful that you do, and
Mhm.
one sin is no different than the other.
Right.
I mean, you
Yes.
got, even if you,
Just
some of them stay with having relationships with people outside of their marriage.
Yes.
That's
Mhm.
just as sinful too,
Yes.
or how you treat someone is sinful.
Mhm.
How you treat another human being is sinful, but you still do it.
So what I'm
So-
getting out of this, and I hope that the ones that are listening here, which is so important, is that it doesn't matter how that person looks to
No.
you, they're still a human being.
Yeah, human.
And we still need to treat them with the same humility
Mhm.
that you would want for yourself. And since we're talking about health and being service, we have a physician here that his mission is to take care of, and that oath that all physicians have to. What is it? How do you say? What is the oath called?
Hippocratic oath.
Yes, and it's to what? Can you explain that to
Basically, do no harm.
no patient?
No patient.
No patient. So if you take that oath to do that, then how can you say to this population of patients, I'm not going to take care of them? And one of the things that I would hope that I am giving some a voice to, and hopefully we're opening up today for, if there's physicians listening, we need more clinics. We need more places that these individuals can be cared for and educated. And I just, are there places that we can now, at least even family members that are being faced with having to accept their child coming out? Is there a place that they can go and get?
Well, there are clinics that do take care of transgender clinics. I work in one.
Okay.
The State Health Clinic, I'll be starting June 1st there.
Okay.
But on the other hand, it's not that they should have special clinics, although unfortunately the program at Texas Children's was shut down for the children who have, teenagers have the most complicated problems.
Mm.
How do you get to the point where transgender patients can come in and see
Any doctor.
any doctor?
Right. They should. They should
That's
be
right.
able to. They should be able to.
Well,
But they run into this fear that they won't be accepted, though.
Yes.
that's
That'd be
it.
a great
And they'll
feeling.
be told, I don't take care of patients. I don't take care of patients like you.
Mhm.
Mhm.
Wow. So
And
Yeah.
so they don't disclose that they are transgender. If you can't tell, some you can't tell.
Mhm.
And so they don't disclose that they are male going through affirmation.
And they don't want to go necessarily to a transgender clinic. They want to go just
to a
to the
clinic,
like
Regular
a-
clinic.
just like everybody else.
Mhm.
Yeah.
Yeah.
So
Well-
after having said that, there's got to be a great deal of individuals just die without even being
Treated.
treated for any different.
That's right.
Is that correct?
Yes.
Because of the fear of being rejected more than they've already been rejected.
Yeah.
And then when it comes to work employment, it gets even more complicated.
Mhm.
Mhm.
Finding a
Just get
job. getting a-
harassed.
Wow.
And one of the studies I've looked at, I'm sorry, at just about 6,000 people they did a survey on that were transgender people. And they even found that they're assaulted when they go to a doctor's office. That is totally I just couldn't believe that somebody who's a medical person would assault another human being,
Mhm.
but they're assaulted, and so, like I said, they hide, they don't tell you,
Mhm.
What's-
and they go to the emergency room 12 times more than they would normally go to a regular doctor
Mhm.
for
because-
their care because they're afraid to go. They're afraid they're going to be discriminated against.
Mhm.
Wow.
They don't even know how to express
what's going on.
what's going on. So that's one of my things I'm doing is trying to teach communication
Mhm.
and help them to learn how to be their own self-advocate.
Yeah.
Every
'Cause
now and then
because-
there'll be pharmacists who refuse to fill the prescriptions.
Is that right?
Oh, wait,
That I didn't know about.
Can you repeat that, please?
Every now and then there'll be a pharmacist who refuses to fill the prescription.
And why is that? I mean, wow. A pharmacist, they're not.
This is racism, baby. Prejudice.
Mhm.
That's what it is. It's been,
Ignorance.
there's
Mhm.
been, it's more to it than being ignorant, I believe, because I look at it on the people-to-people perspective.
Mhm.
And, I
It's
think
just-
people just fearful, like the lady sat next to you and actually have you been tested lately?
Mhm.
There's just a fear
Mhm.
that she had, like the same fear that people are having when someone cough around them today
Mhm.
with this thing called COVID out
Mhm.
here. There's a lot of different things. We just get in our heads too often. And to go back to your point, Miss Evetta, about the church Bible, the Bible backing people,
Mhm.
it's easy to point a finger
Mhm.
at you about your sin,
Mhm.
but I got 3 pointing back at me.
Mhm.
That's more than what I have at you.
Deflection.
And so,
Yeah.
often we don't want to look at our own sin.
Mhm.
We often want to. It's easier to look at
And point out
someone
else.
else's sin, so we can pick our head up as if we are a little bit more than somebody else. I think Doctor alluded to that also,
Mhm.
being able to just stand up over someone.
Someone is to make yourself
Yeah, to
feel
make
good.
yourself feel better.
Mhm.
So,
I have Crystal, if you could. Crystal, you have a question that you wanted to ask here. If you can, get the mic and go ahead and ask them your question, please. There you go.
As a health professional, can you explain why transgender people have a higher risk of HIV?
mhm.
Well, the male to female patients have a higher risk of HIV because when they transition, they want to be wanted as a woman. Some of them will be involved in prostitution and things like that, or just be very promiscuous.
Wow. Did that answer your question? Okay. If you could.
So that sounds like they're not just in isolated
situation.
encounters. They're having multiple encounters. That's what I'm hearing.
So do you find that happens not just in the trans gender population, but it's also in just, I mean, is it just the transgender that you have a higher population of AIDS?
Transgenders as a subgroup have the highest incidence of HIV.
Mhm.
Although, as I said on one TV show years ago and was censored, not to offend anybody, an erect penis has no brains.
Mhm.
You didn't offend, it was the truth. You didn't, you said the truth, yeah.
And then Dr. Hammill and I were talking about it. It is an increase. We're seeing an uptick of HIV in our male to female transgender patients. And because of that reason, you're seeing an increase. And
Is it
I
because
think-
of the prostitution or just kind of having
Promiscuous.
promiscuous, being
okay.
promiscuous, and then some are going to prostitution as a way to get their money to finish their surgery.
Okay, okay.
Yeah,
Because
it's
finding a
very
job is-
expensive.
Yeah.
And it
What
went
is the
up to
cost?
100,000, 60 to 100,000.
Well, if they go to Thailand, though, they can get it done for like 20 or 30.
But
Wow.
here it's
It's much more expensive.
So they actually have clinics here in hospitals that would do it, but they are,
No, they don't. There are a few surgeons, usually plastic surgeons or urologists.
okay, okay.
There's some in Lubbock, there's some in Houston,
Okay.
there's some in Canada. There's a very famous doctor who was a male, became a transgender female, and specialized in doing transgender care.
I would assume that none of this is covered on insurance, that
No.
this is out of pocket.
Usually
Or-
none of it's covered.
None of it's covered.
none of it's covered.
None of it's covered.
Why do you think that is?
I can't
It's
hear
not accepted.
Why do you think it is that they wouldn't cover that as the cost of it?
Because they don't accept the diagnosis. Now, I will use what I call protective subterfuge.
you. Okay.
Protective
Can
substitute.
you explain that for people that
That
are not in
means-
medical?
It's a male to female. No, it's a female to male patient. So they have a uterus. If they have a medical indication, like if they have big fibroids or bleeding or something, then I can take their uterus and ovaries out.
Mm.
And it coincidentally, it will help them with their transition. So I have to have a medical indication that's accepted by the insurance company. But this goes deeper than that because all across medicine, the MBAs, no one has an MBA here, do they?
No,
The business administration people, they run the show.
that's who run the show. The bottom line. Yeah,
Not this show, but
that show. Exactly. Yeah. Wow.
that's the problem. And they just arbitrarily made a decision. And the more they cover, the less money they make.
Well, and I'm glad you're going there because everything in healthcare is driven by the dollar. It doesn't. We're talking about this service line, but when you really get down to it, let's go back to when we're trying to get affordable healthcare passed. The reason why it was such a struggle to get that passed is because the MBAs were looking at their bottom line. When in fact, if they looked at it really closely, they would make more money because you'll have less patients out there in need of care. Because, or should I say, the more serious cases, because they're coming in to see their doctors more frequently. So they're staying out of the emergency room and out of the hospital. Would you agree with that?
Yeah, well, the arbitrary decisions by MBAs on what to treat, what not to treat, what to reimburse for, what not to reimburse for, basically determine medical care.
Yes.
That's right.
So it's not the doctor making the
It's
decision.
never.
The MBA is the worst thing that's happened to medicine.
Wow.
I have a question.
Sure. Come on, Diane.
Do you think there will ever be a time where that's going to be accepted to cover insurance to cover operations like that?
Yes. As the political football shifts against the discrimination.
Okay. Well, if you're saying that, then look at what's happening right now with Roe versus Wade. I mean, if you're going to take us back, you're saying yes, it's going to come a time, but they're talking about taking us back. So how?
Yes, and unfortunately, I anticipate we'll see more women dying because they've been driven to criminal abortions.
Yeah. I'm glad that you express your personal and professional opinion on that because that is very serious. That's exactly what I agree. I think
And my opinion is whatever choice a woman makes is the right choice for her.
that's her choice.
Yes.
It's her body.
I think the other thing is we didn't talk about dysmorphia.
Let's talk about it.
What is that? What is
Dr.
dysmorphia?
If I,
Hammill.
I think I know what that is.
Mhm.
You can define it.
Huh?
You can define it.
Let's hear you.
Okay. Well, in terms of feeling that your body is something other than the sex that you were born in, you have, you hate your body. It's, looking at yourself, you need to make a change. This is not what I like about me. I hate my body. And I think um, that's part of they have to go through the year of living as in that particular gender first
Before the surgery.
before the surgery is approved.
Well, I have a question. How do you know when it's a fad versus this is what I mean? This,
They have to see the psychiatrist as well too, and they
But-
give them that diagnosis.
I get that, but how do even
First of all, the ones that are just trendy,
Mhm.
not really transgender, they fall by the wayside. The novelty wears off after a couple months or a year.
Mhm.
it wears off?
Mhm.
Yeah.
Okay, so
That has not been a big problem.
that's not. So usually when you start to see someone,
And follow them for years.
it's been there. It's
Mhm.
not. It's just they're just. This is who I am.
Mhm.
Yeah.
I'm not going to hide anymore to make you comfortable. This is who I am, and I'm ready to come out.
Mhm.
Oh, okay.
I'm ready to come out, and you have to think about it, how that's so dynamic that somebody would want to go through all of the surgeries they have to go through to do a gender change. It is a whole lot.
Mhm.
You've got to live as if you're female or male, whichever one you want to live. You got to live that way, and then you've got to worry about family acceptance and people that you work with, and going to the store or whatever, or your friends and whatever. And then you've got to get to the part of the surgical part. It's just so much they have to go through.
Mhm.
So you have to wonder to yourself, maybe this is really what they do feel, because it's so much pain they go through, and it's a lifetime thing they have to do. It's not just get the surgery and you're done with
Mhm.
that.
The other thing is, when you see them after they've been on the hormones for a while,
Mm-hmm.
they're much happier.
And that's what I want to know right
Yes.
there. Do they really find this place of happiness after they
Yes.
transform, or do they still have a state of confusion? Are all cases the same, or some
All
are
cases,
different than
yeah.
others?
All cases vary.
They vary.
But by and large, once they get on the hormones, they start changing. They're ecstatically happy.
Wow.
Wow.
Wow. So this is something that has been plaguing them for a long time. Now I am basically free, no different than someone that's finally finding their voice.
Mm-hmm.
Mhm.
They have been suppressing something that has been bothering them for a very long time, and now I have said it. So now I'm.
Perception is reality.
Yes.
And what's so sad is that people think they've been saying that this is, something's wrong with them psychologically. This is an illness,
Mhm.
that's been planted in them.
Mm-hmm. Yeah, it's an illness. And is it that somebody would go through all
So
of
you
this?
saying this is real?
I feel it
This-
is. I feel it is. I feel it's real for people, and they really do feel that way. And I think those that are trending, like you said, it's just a fad. I'll do it for now.
So
Try to go back.
when I say this is real that they were born mistakenly the wrong way.
Yes.
I can't say that. I don't know that they were born mistakenly the wrong way. I just know that they have this strong feeling that they need to change their
Right.
gender to something
As
that's
my
more
mother
comfortable.
said, there's a spark of the divine in everyone, and we can't say God made a mistake.
Mhm.
Mhm.
You can't, or you
Can't.
Can't
You
say
can't.
God made a mistake.
right.
So if they are, and I can see how that can be confusing for
Yeah.
someone on this
Mhm.
side. So if they were born a male or a female, then they were born, and this is how they were created.
Hmm.
God doesn't make a mistake.
Mhm.
Then now you're telling me that what they're feeling on the inside is opposite of what God created. So help
I'd
explain
say-
that to me.
In India, they categorize it as the third gender. So I just
What
say
that mean?
the transgender population is the way God created them.
So God created male and female. He
And he-
didn't do gender. I mean, we're just having this conversation since we're going there.
Mhm.
If God said in His Word that He created
Adam and
Adam and Eve, help me.
And there's
Something help me there, Doc.
something in between.
But where? And I'm not. Again, I'm speaking only from what I don't know.
Yeah, all I'll say is the idea of someone born in the wrong body.
Okay.
Born in a body, that's a separate group of people.
Okay.
That's a large group of people today, though.
I know how large, but it's a definable group,
Mhm.
and they're still humans.
Well,
Yeah.
I 100% agree with you on that. And so at the end of the day, it's not for us to judge or us to place out, determine, and I'm not going to take the word and try to beat somebody as if I have this.
Superiority.
I'm not doing it. My question, the reason I asked that question is because I was just trying to.
She wanted to keep her husband from making the blunt statement.
I was trying to clean you. I didn't know I saw it coming. He was going to go, whoop.
I think it takes a lot of negativity for a parent to reject their child.
Say that again.
It takes a lot of negativity for a parent to reject their child.
Yeah. Yes.
So you still love that child.
Mhm.
So in other words, what I'm hearing is that what I would feel, that's still my child.
Mhm.
And nobody's going to make me, as a parent, turn my back on my child.
Yes.
So I
But
would
you'd be
talk to them.
surprised how many people do
I know that it's a whole
reject them
bunch
totally and just take them like they
like they're gone.
never mattered.
Mm-hmm.
How can you do that? That speak to that individual also.
That is that individual. It's something on that person.
How can you do that?
How could you create something and then
Let me throw something else out there.
Chunk it.
I will tell you that many of the transgenders are engineers. And engineers, I guess, are often in their corner with their numbers and stuff.
Mhm.
And the space shuttle would not have gone up and landed if it wasn't for transgender engineers.
Wow. Why is that? You would say that a lot of them are engineers, so they're highly intelligent.
I guess engineers are often their
They can work
corner
in their
with the
corner.
numbers.
And so, wow. So in other words, they can go over here and nobody really has to deal with them
Yes.
except that just go do the job. Just go over here. We don't have to talk. Wow.
So they're not all, they're not, I don't want to give the impression they're all promiscuous.
Mhm.
Okay. Diana, I see you have
We're
a
gonna
question.
take
We're going to take a break after Diana come with her question.
So my question is just like, have you guys ever had a time where you completely, I guess you could say, where you did judge somebody because of who they believe they were? Like, have you ever rejected somebody and then accepted them at some point?
Good
You
question.
mean the esteemed guest you asking that to?
This is
Yeah.
anybody. This is open to anybody.
Well, I'm going to go ahead and answer that. I'll jump in there first.
That's you want to answer that?
I am the host.
Okay.
I want to answer that question. Are you talking about do I want to go to break and then
Yes.
come back? Oh, that is a good. I think that's a good question for us to think on and then come back. I thought you wanted me to let them answer first.
no.
We'll take a break.
Mhm.
We're gonna think on this question and we'll be right back.
All
All righty, we are back. Miss Diana, you threw that awesome question out there. I'm gonna ask you to throw it one more time, and
Yes.
we're gonna take it and go with it.
My question was, have you ever been responsible for judging somebody
Or rejecting.
or rejecting somebody in any way, shape, or form
Based on their difference.
based on their of you not agreeing with their life choices?
Mhm.
And once again, I put myself out there first. And so I have to be completely honest. Yes, I rejected the notion of someone being gay. And I think I rejected it because I no, I know I rejected it because of my own fear of how, of my own fear. There is no other word for it. I have a son who I absolutely love, and I had to reject that because I didn't want him to experience, and I didn't want to experience what he was going to go through. But that quickly changed as I looked at my son. I am not going to allow ignorance or anyone else to make me turn my back on someone that God gave, blessed me with.
But did you reject the individual or the spirit, or what was the
I
rejection
I
about?
rejected the whole notion of it. And so when people like to put it in compartments, for me, I just rejected. I still loved, but I loved with my. I rejected it. You know, I'm just going to be honest. There is no such thing, in my opinion, when you try to put a bucket in it, you still trying to make yourself feel good. A rejection is a rejection, and so no, I did.
Did you ever see him get rejected in front of you?
Oh God, they better not. But that's why I had to fix myself.
Mm-hmm.
You know, I tried to act like I didn't see what I seen. So it wasn't a rejection that I did to him. It was a mental thing. No, that's not what I'm seeing. And so I think that it was never I pushed him away. It was like, no, this is not what I'm seeing.
Okay.
Okay.
Yeah.
Evetta, your question.
Yeah, I'm just gonna add to well, my own rejection was working at Jefferson Davis Hospital many years ago, and I had this patient who she and her boyfriend had put her baby in the oven and cooked her baby, and it was very, very difficult to work with that patient, and I had to process that. So what I decided was let the charge nurse know how I was feeling about it, and that we all rotated caring for that patient. Every other day, she would have another nurse, so we could all process what was going on. And it was just the most hardest thing. And I had to remember, look, this is not about. This is what she did. It's not for me to judge her. I'm a nurse, and I'm supposed to care for this patient no matter what.
Mm-hmm.
And that helped me, just see her as
The patient.
the patient and not judge her.
Based on
Because
the individual,
yeah,
and
because
the act.
the individual act, and this was her baby that they had together put this baby in the oven and cooked the baby in the oven, and I couldn't imagine how the child was alive when they did this. So it was just so hard to work with her. So yes, all of us have had some times that we've rejected people for whatever reason, but
That was your personal.
that was my personal experience, and come back and you realize that this is still a person, and that's not for me. She was already in the custody of Harris County, and they had already sentenced her,
Yes.
and so she was pregnant again with another baby. So it was just very hard.
Yeah.
All right, Doc. What about you?
Well, I had a patient that comes to mind. She was pregnant, HIV positive.
If you could.
I had a patient that came in, she was pregnant, HIV positive. She was white. And you go to examine her pregnant belly, and she has a big swastika tattooed on her belly. Her boyfriend's even worse. I figured, well, I want this baby to be healthy. I had a great deal of trouble with them as a couple.
Wow. Yes. So, how did you press through that?
Well, she had a healthy baby. The boyfriend occasionally would threaten me, but I think that's part of his image. And I just view them as having some problems that I couldn't necessarily change. But maybe by delivering the healthy baby, they'll realize.
Okay. All right. And you, Brother Carter?
I think we everyone just spoke of. I think we all had some kind of encounter in which where we had different perspective, should I say, of individuals. And I don't want to call it an actual rejection, but I just say that I had a different perspective of what that person was. I had a prejudice uh, against fat people.
Yeah,
You know,
yeah.
it wasn't about the color, it wasn't about the creed. It was just about they were bigger, they were big folk, and I had a prejudice against fat people.
And why is that?
I ignorant.
What was your prejudice exactly?
I know I just couldn't deal with people, and here I am sitting on here on national TV in front of tens and tens of people, and sitting there with this stomach sitting up here like
like you fit inside.
Yes.
But you had that. You had that.
Yeah, but that was in my young adult life. When I was a young man growing up, and so that feeling was rejected within me through the gospel,
Yeah.
and I was able to see people as people.
Yeah.
You know, everyone is different. We all are different. And if we learn to just love one another and accept one another as who they are and who we are as individuals, because I think most of the time when we're rejecting someone, we're actually rejecting ourselves
Oh, yeah.
because we don't really appreciate who we are. So we can't accept you for who you are. And I think that's where the ultimate place comes in, is within oneself. Am I making sense?
That was very profound. That was very good. Since you asked,
What you think on that, Doc?
I agree.
Yeah. Why don't you do me a favor? I want you to turn to the camera over there.
Uh,
And I know,
that one right there.
I know a lot of people are thinking that, man, Val and Lawrence got the head of the CDC here with them. Actually, Dr. Fauci is in the building. But this is Dr. Hammill, and he's a bright doctor. He's been around a long time doing a lot of great things, and I've even heard he's even worked with Dr. Fauci
on many of the HIV pregnancy studies for the NIH.
Wow. And go ahead.
So-
I'm sorry.
So just want you to know that, you know, when we bring people to our show, we really like to have credible individuals that come to this show to bring light to very, very touching subjects. And I told you guys this morning, the Love and Victory show with Val is going places that no man has gone before. And here we are talking about transgender and gay and lesbian and all this stuff, different stuff. And it's really not enough time in the day to really cover a lot of this stuff that we're talking about. But we do want to thank Dr. Hammond and Miss Evetta for coming on to the show, being bold and beautiful enough to talk about these subjects at hand. Yes, and hopefully we can say something that may be able to resonate in someone else's mind that's listening to the show today, that they may want to accept themselves for who they are, and hopefully once you accept who you are, the rest of us can accept you as well. So I hope that we can get that.
I would like to do this. Normally we have to rush at the end, and I don't want to rush at the end. I really want to give you an opportunity, Doc, to educate us a little more about, because I know we're talking about transgender, but I also really want to educate the community on AIDS, because it is such a growing disease that is happening in the Houston, Harris County area. Let's talk on that a little bit more. I would like for you to educate the community, let them know that where they can get help at. They don't have to stay in the dark. If you could, just
And preventions.
Just keep it very clear and very.
Well, prevention is education. Use condoms if you're concerned about any risk.
What about, I don't even want to say about using condom if you're concerned about risk. How about if you're out there even thinking about having sex or you're wanting to have sex, shouldn't you use a condom?
I would say yes.
Okay, so let's talk on that because this younger generation,
Especially in this community
this
in which we
community
talking.
about, I really, really, really want to make sure that we are driving home how important it is to have protected. If you're going to do it, make sure you're
And
protected
if you become positive, it will change your life
forever.
forever.
Okay.
We can help you with medication. It's a chronic disease, but it still has it will change your life. If you can prevent it, it's well worth
And it starts with education.
education and self-esteem.
Mhm. Did y'all hear him say self-esteem? So
Yes, you
yes, and we're gonna uh, actually. I want to dig into self-esteem a little more before we go
Mhm.
because one tend to say I have self-esteem, but I am still out there having unprotected sex. That doesn't make sense. So can we really talk about self-esteem and talk to the younger generation? And I know that there are older people out there doing it too, but I really want us to talk.
Well,
about
sometimes what even makes it worse, the pregnant teenagers, and there's only one middle school in Houston that doesn't have pregnant teenagers.
Mm.
Only one middle school, not
One middle school.
and that's T.H. Rogers for the gifted and handicapped kids.
That is the only school.
Middle school.
Middle
Middle
school.
school.
That's a
So he
middle
said
school.
middle
All the
school.
middle schools and high schools have pregnant,
Every other middle school.
and high school have pregnant teenagers.
Yes.
Wow.
And what makes matters worse is sometimes the principal will say, "You're pregnant. We make the school look bad. Drop out."
Mm.
Wow.
Then we have a pregnant teenager dropped out, and their life spirals.
Can I ask a question regarding that?
Yes.
So I remember that before there was like classes about health, but I know they were removed from like HISD and all these schools. Do you think it would be beneficial to bring that back? Do you think it
Yes.
would reduce it?
I think it would. And in the old days, the gym teacher would give the sex education,
Yes.
which was probably the worst choice.
The worst choice ever. Yes. Uh-huh.
So I think yes.
So what age do you think would be the best age to have sex education classes or courses?
Well, age-appropriate sex education should definitely start in middle school.
In middle school.
I agree with that. And I'm not so sure that HISD has gotten rid of health classes. I think they got rid of physical education, but I think they have some type of health classes there. I don't know that they talk about, because it's such a hot topic, not to talk about teach sex to people's kids and so forth. But there's certain things that you do need to know when you're in middle school, starting there, where you really understand anatomy, physiology classes. They can be, tailored to that group. Not that you're teaching sex education per se, that you need to get birth control, and nobody's saying that, but you need to know
The consequences.
the
Yeah.
consequences of your action.
Why
You
did
really
they
do.
stop physical education? Was
Politics.
this surrounded around
I-
what the subject matter today?
I don't know what the reason was. Someone told me, a few teachers told me it was because they went in their budget. But in your budget, that doesn't make sense to me.
No.
But I don't really know why they stopped, because I know we always had it.
Yeah.
Some parents didn't approve of it also.
Oh, okay.
I know
Okay.
that as well. I remember
Mhm.
I didn't personally take the classes, but I remember seeing girls, and it was like a couple, like they would become the couple and they would take like fake babies home, and the baby would like cry
I do
automatically.
remember that. Mhm. 'Cause
And they would throw up, or they would like do number two, and it was like you had a baby, like you
Mhm.
had to take care of it,
Yeah.
and your grade depended on you helping this baby survive.
Yeah.
Well, I think that's your generation. See, that's a whole different level than what we had coming up.
Yeah.
We
yeah.
didn't have babies. We
Mm-mm.
actually had a conversation,
Mhm.
and they would talk to us about health education and
Mhm.
about our bodies. Yes,
Mhm.
I would agree. Maybe the PE teacher wasn't the best place
No.
to have it. So
Mhm.
then we ended up having a health class.
Mhm.
And so I think that class was very helpful because you had a lot of parents and kids that weren't able to, a lot of kids that weren't getting any conversation at home.
Mhm.
And something about teen pregnancy being a very, very high in the South, much higher than it was in the North. And I think a lot of it, again,
Education.
I am unlicensed, untrained to be able to really speak to it. I just believe that a lot of it came from a lack of education, and it's still
absolutely.
happening from a lack of education.
Absolutely.
I don't think that no one has the right to tell me how to raise my kid. However, I do think that we should be helping each other raise our kids with an education. If a physician is saying age is going up in this population in Harris County, it's one of the highest in the country. Come on, guys, we need to start looking at what's going on out there. We need to start talking. So, Doc,
Well, we need to have medical care, not be part of politics.
yes. Did y'all hear what he said? Medical care, not politics. And yes, it's politics and everything, but that's what's hurting us.
It is.
But you can't achieve anything without first going through the politics, because politics where you get your fundings and all of this from.
Yeah, it's different when and I probably will have to do this, standing over at the body of a woman who's bleeding to death because they're septic from a criminal abortion. And I have blood on my hands because when you take care of those patients, when your boots are on the ground, you have a different perspective.
There is not politics. This is, I got to save this life. Yeah.
And going back to really quickly about talking about the teenagers and pregnancy, I do remember because I used to work for DePelgin under Baylor at one time, and how, you had places, it was like a school for pregnant girls to learn how to take care of themselves and their babies during their pregnancy. You don't see a lot of that now. They're mainstreamed back into regular classes. So you kind of miss that education that you need and direction you need where, you're isolating them. It wasn't isolating, it was teaching them you're pregnant, how to take care of yourself, get to your doctor, what you're going to do when your baby comes, planning and all that. They don't have that anymore. You have one or two schools, I think, still exist for schools, but most of them have been mainstreamed back into so they miss all of that. You got pregnant, to get a chance to be in a group that you get more education when it's in a specialized school, I think, and they're not doing that anymore.
Again, going back to, we have two young adults over here. Crystal just turned 22, 23. Yeah,
23.
Yes, I know. We don't want y'all to grow up. 23, and then we have Diana. How are you over here? 21. Doc said something that is so profound to me, and I'm speaking to the young ladies, and I know that there are gentlemen listening. He talked about respect, self-esteem, respecting yourself. Can you guys speak a little bit, and I want Crystal to start this, answer this question for me. Why is it that some of the younger generation, not all, some of the younger generations are so free, sexually free, and just taking such a big risk?
My opinion.
Yes.
I think it's just more so of the living in the moment type of thing. It's not of a thinking about the long-term effects of it, or it's just like, we're being candid. I just want that pleasurable moment right then and there. And I feel like with my generation, for sure, it's more so of I'm here for a good time, not a long time. So
I appreciate you being honest.
So with that, it's like, yeah, I'm gonna have all this, high self-esteem or high confidence or whatever at this moment. Like I said, I'm here for a good time. In the long run, I'm not worried about the after effects of it. So it's like, it is what it is.
Okay. So why is that? If you have the high self-esteem, you have the confidence, why would you want to live in that moment?
I guess, and this is the answer that I'm giving just based off of my generation.
Yes.
Why not?
Okay. Okay. So
So what I'm hearing is that futuristic
it's not even on the brain
thoughts are not even there.
No.
We're just thinking right now.
right now.
Right.
Right
Right.
now.
The only futuristic
Here
thing,
today, gone tomorrow. That's all right. But I was here.
chunk the deuce.
So,
Yeah.
Doc, how do you treat a patient or that generation?
That's what he dealing
I
with.
know that. I know that. I know. But the reason I thank you, Crystal, you always go there.
That's why.
Yeah, you just throw it out there. So, Doc, how do you educate and treat and a parent and protect that generation?
Well, unfortunately, by the time I see them,
It's too late.
they're
Yeah,
positive with
yeah.
HIV or they're pregnant or both.
Mm.
And
Okay.
then things hit the fan.
Yeah.
Reality becomes hard. And then I'm just trying to tell them life goes on. Life is a journey.
Mhm.
We are to improve.
Okay. So, what would you say to someone that has not uh, made that?
Reached you yet?
I mean, like my grandchildren.
Yes. Grandchildren, if y'all listening, listen
Or
right now.
My mother used to tell me, when you go out on a date, just think you're with one of your sisters. That was terrible advice.
That didn't work. Okay.
But I think just if you've raised them right and you love them, and people can feel love.
Mm.
Most of the time, it's not that I want to be crazy. I didn't want to disappoint my parents. So I think just loving your children, giving them a hug
Mm-hmm.
Okay.
and talking to them. Be open to talking to them.
Talk.
Now, the best time to talk to your children about sex is on long family trips. They're in the back seat. They can't escape, and you have them trapped.
That's the best time.
When I did this with my daughter, she said to me, "I knew all this stuff already, Dad,
Mm-hmm.
I just need to make
but
sure.
you have to talk to them about it."
Okay.
And
you have
not
to-
be afraid to have the conversation.
And when they're locked in the back seat on a long drive, that's a good time. They can't escape.
Mhm.
And
That's good advice.
I
there.
think the other thing, and I'm going to go to, I know Diana's really wanting to jump on here. The other thing is you can't shut down the conversation because you can't handle it. If you're going to open that conversation up, parents of our older generation and some of the new, we have to be willing to allow them to speak and hear what they have to say. That doesn't mean that you can't give your advice, but remember, you got to let them talk.
But too often with us older generation, we want to interject our own beliefs on their beliefs, and that's something that we we have to learn to make an adjustment on.
Well, you have to, when young girls have their first period, you have to prepare them for that.
Mhm.
Otherwise, they become terrified if you haven't talked to them.
Yes, so true. So true.
And to something he said, Lawrence said that was very key. What we think is self-esteem, it's not what they think
It's
is
not what they
self-esteem.
think, right?
So you've got to learn what they think
What
is
they're saying,
what
yeah.
they're
Mhm.
saying, what their self-esteem. How do you define
Yeah.
self-esteem?
What does that look like for you?
Yeah, what does it look like?
Yeah.
And with that being said, Crystal, since you brought that
Since
up,
I answered the first
since
one.
you asked the first one, what does self-esteem look like to you or your generation?
To me,
Uh-huh.
self-esteem to me looks like I'm at a 10 in my mind, and there's nobody going to take me away from that mindset because I'm confident in myself. I'm confident in the way I express myself, the way I communicate, and just the whole nine. And there is no, if you judge me, you either gonna like it, hate it, or love it.
Okay.
And it's either take me for I am or not.
That's how you define it.
That's how I would define it. It's just living in your truth, like being comfortable with yourself where nobody else can break that confidence from you.
Okay.
I feel like if your self-esteem is high and stuff like that, not 9 times out of 10, you don't really have any judgment or any issues with anyone else because you're not trying to compare yourself. You're not trying to live somebody else's life.
Okay.
And with somebody with low self-esteem, it's more so of I know I'm not fully confident in myself, so let me go and cause havoc on your life when I know you're living comfortable.
Oh, okay.
Sound like that person, the unconfident individual, is the individual that's wavering between where they want to be
Exactly.
in life. Do I want to be gay? Do I want to be straight? Do I want to be
Sexually
blonde, or do I want to be brunette? You're just wavering.
And I think with that too, you're wavering because you don't know yourself.
Confuse yourself.
But if you have self-esteem, it empowers you to say no if you don't want to have sex.
Right.
Yes. Yes.
That is key.
See what I
That's
just heard, and which was very good. Our interpretation of the older generation is basically saying the same thing, but just saying it different. What she said was, I respect myself because I'm here.
Mm-hmm.
And the way Doc just broke that down was, you have self-esteem, so you have the power to say yes or no. But when someone hear you say, I'm just living in the moment, to our ears, it sounds like low self-esteem.
Yeah.
Right.
But because we now had a conversation about
Mhm.
that, it sounds completely different. Okay, no.
Because
that's-
she's saying I'm living in the moment. I have a feeling and I can roll with it. She confident in just being able to roll with the feeling.
Right.
And-
But it was more behind that. So we're going to hear, Diana, we're going to go to your question. You had a question for me? Are you getting ready to say something?
You was asking
Oh,
her.
I was
Ask
just
her.
I was
Gonna
just
gonna ask her.
piggybacking on him because something that I really noticed was it was the way you're raised by your parents.
Mhm.
So, and that is, were you present as a father and a mother? Were you advocating? Were you speaking out and saying, "Hey, sweetie, you're gonna have your period at this. This is what it's gonna feel like. This is why you're having it."
Mhm.
And if you don't teach your own children, they're gonna hear it from somebody else.
Mhm.
And if they hear it from somebody else and they're not telling them the correct information, then your child is going to make horrible mistakes because you didn't take the initiative to tell the child, hey, this and this is going to happen. And you're responsible for teaching your own child about it. That's the issue. And personally, I saw a lot of like cases where I had girls my age. I remember being in middle school and this one girl, she got pregnant. And the reason why she got pregnant was because she thought that her dad beating her, that going and getting pregnant and going with another man was going to be better than living with her dad that was beating her. And it turned out to be the same thing with that man.
Yes. Wow. Whew. I tell you, this conversation has been we could just keep going on and on and on, but we are at the top of the hour where we have to end the conversation. But I want to thank you, ladies. Thank you, team, for just being so candid and so open, because I think that a lot of what is going on in the world today is that we're not listening and talking to one another. But I want to do what we always do. We go around the room and we wrap the show up. We start with our guests, and we ask that you share what if your experience on the show. We ask that you leave the guests with any advice or anything that you want to, and then tell them how to find you if they want to come and connect with you, or if they just need to talk to you, or if they want to be treated.
Okay. Thank you for having me on the show. I thought this would be just radio, so I don't know if my face is good for TV.
Your face is fantastic.
And I'm flattered you asked me, and I hope we raise some consciousness of people listening. I'll be at the St. Hope Clinic. Can I give their phone number?
Yes, you can.
281-779-8705.
Put that in the caption.
St. Hope Clinic, and my name's Hunter Hammill. And I'll talk to anybody
Anybody.
if you just have a question.
Go ahead and do it one more
St.
time.
Hope Clinic, Dr. Hunter Hammill, 281-779-8705. Life is a journey.
Life is a journey. And Miss Evetta.
Okay. I've just really enjoyed this conversation. This praise station. loving and enjoying the music was very inspiring, and the conversation was most inspiring for me. Um, what I hope will happen is I know I will encounter some patients as I'm doing my scholarly project, and I'll be with Dr. Hammill at that time. So during that time, I hope I get a chance to share how best to communicate health issues that transgender patients I encounter have during my experience, and that this spreads on through nursing practice, because it is very important that people know that you may not want to care for a transgender patient, but if you don't know they're transgender, it can impact not only your patient, it can impact your practice as well. So that's what I'm hoping, that my experience will just resonate, and that nursing incorporates transgender care as a part of their curriculum going forward.
Okay. And Diana, what was your experience? Did you get anything out of the show today, and what would you like to leave with?
I just wanted to thank you guys for speaking out, for people who needed others to hear it. It's not easy to I guess God always tells us to like help the weak and defend them, and it's not easy to speak out and defend them and go against a whole society at times in order to help others. So I appreciate that.
All right. And Crystal?
First, I want to just say thank you for joining us this Saturday morning. I know that was probably difficult for us. And then also just thank you for just being candid with the listeners and the audience about this subject. I know it is a subject that is not cared to talk about, I would say, amongst a couple of people. And so I just thank you for just, being professional about it, and, learning and embracing and teaching everybody about the subject, because it is something that everybody needs to learn and understand. So I just thank you for joining us today.
Okay. And I'm going to go ahead and, Brother Carter, you have anything? You
You
good?
want to be last or?
No, I'm going to be last. I'll let you go.
No.
There you go.
So, all right. Well, I would say this was I told you at the beginning, the Love and Victory show with Val was going places that no one has gone before. We didn't go to the moon or nothing like that, but we did go to a conversation that has rarely been spoken of and to about. And so I would say to the parents, to the siblings, and to the people out there that's listening, let's face it, we all have gay people in our families. Let's learn to love them and accept them for who they are. In my household, I accept them. I accept you for who you are, but I just ask that you do not prance that in my audience, should I say, in my home, should I say. I know you may have gay friends and things of that nature. This is a step I can take. I can accept you, but please don't bring that to my house. Your friends to my house and hugging and kissing in my house. I can't accept that right now. I haven't grown to that place, and so I would leave that with parents that are out there that do have children and are out there that have gay children. Don't just disown them. It's your child. Keep your child close to you. That's all.
All righty. And I have to really support this whole conversation. It's a difficult conversation to have. It's a difficult place for anyone to be in, but it starts with the conversation. We all have differences. We all have disagreements, but when we respect one another in this journey called life, in this journey of experiences, we can make a big difference. At the end of the day, it's always about love. And what my husband is saying, and he's saying it to, and I respect him because this has been a journey. And he's saying, I'm going to meet you where you're at. I need you to meet me where I'm at. And if we can meet each other where we're at, where each individual is at,
we'll be all right.
We'll be all right. So I want to thank you, Doc. Oh my God.
My pleasure.
You are amazing for this time.
You've been talking to my mother.
And you know what? If your mother is looking at you right now, she's sitting. I know there is a smile. She is smiling from heaven. She's pretty proud of her son because you are just caring for God's people. And for my sister, thank you for being the bold sister that you have been since day one, the day that I met you,
Mhm.
for introducing me to this phenomenal man, this gentleman here that is truly doing a work for God's people. Uh, it may not be a work that's pretty, it may not be a work that everybody agrees with, but they should agree with giving good health care. That's simple. It's just that simple. Caring for people that need to be cared for. If we can do
Aaron
it,
is sharing.
if we can do more caring for people that need to be cared for, this world will be a better place. Get yourself out the way and let's just start caring. And to raise the praise 100. This radio station here has been more than just a radio station that it's different. It's special. It loves all people. It's been such a blessing to me. They saw me when I didn't see me. And I'm just so grateful that they allow me to sit on this platform and bring candid conversation to those that are in need. Uh, Raise the Praise is a 24-hour online radio station. It is always some good candid conversation going on. We have Ike the Mike that's coming on behind her. They is saved and silly. So just tune in. We're gonna turn it on off because we got to get it cleaned up and get ready for him. And Crystal, how do they find us? Don't bust their eardrums either.
Okay, I won't.
Okay, there you go. Tell them how to find us.
Well, you can find us anywhere on Facebook, The Love and Victory Show with Val, on Instagram, LV with Val, on YouTube, where you have to subscribe to get this good candid conversation every Saturday morning from 7 a.m. to 10 a.m. Central Standard Time, The Love and Victory Show with Val. Or you can just find us on our website, www.lvwithval.com, because everything is Love and Victory and everything is Love and Victory with Val.
All right, if you guys can take a look at the camera and let's tell them all goodbye. Thank you guys. Until next Saturday, we love you.